Hi, this is Erin Dial, physical therapist and certified strength and conditioning specialist. Thank you for joining us today. Last video we talked about why go to physical therapy, and next we're going to move into what to expect during your visit to the physical therapist. So on your first visit, that's called your physical therapy evaluation, you will meet with the physical therapist. The visit will take about 45 minutes to an hour, and we will go through and ask you questions and then take some measurements to figure out what your impairment is. So the subjective part of the initial evaluation is the question part. So we're going to want to know all about what brought you here. If you have pain, how long have you been having the pain? What caused the pain? We may not even be dealing with pain at all. We may be looking more at limitations in mobility or limitations in your daily activities. And again, we want to know, when did it start, how long has it been going on, and how it affects your daily activities. During the physical therapy evaluation, we start to move into the measurement phase. And so after we've asked you all the questions, we have a general idea of what's going on, but now we want to look specifically at the joint and your impairments to figure out if it's a muscle, if it's a ligament, a tendon, what is causing your ailment. Then we're going to look more specifically at the joint level. How does the joint move when you move your joint versus when the therapist moves your joint, and what are the restrictions involved there? Are your muscles tender when we push on them? Are they tight? Do you have muscle spasms? All those things will help us develop a treatment plan to fix your impairments. We'll move into special tests and clearing exams. These are tests that are designed to tease out what tissue is involved. So if we know that your shoulder is hurting, but we're not sure if it's a ligament, if it's a tendon, is there bursitis, do you have impingement syndrome, that's where we go through. There's special tests for every joint that we will run to figure out more specifically what's going on with you. After we've taken your subjective questions and your objective measurements, we are going to develop a treatment plan specifically designed for you. The treatment plan, I'm going to use my clinical knowledge. I'm going to use the best research-based evidence that is out there in the field, and then I'm also going to take in mind your patient goals and what you want to get back to doing. And that's how we develop an individualized plan specifically for you. After you have your initial evaluation, your follow-up visit will start your treatments. The treatments will often be with a physical therapy assistant, or sometimes with myself, the physical therapist. I'm going to give you some basic treatment guidelines of what to expect, but just keep in mind that it's very individualized, and we have several patients that come through the door and it's set up for that specific patient, but this is some general guidelines. Most treatments start with cardiovascular exercise. This has great benefits to increase your endorphins and also to help your cardiovascular health. But a lot of people don't realize it also helps pain. So it brings nutrients to the area and it removes waste products from the area that's hurting. And there's countless research articles out there to prove how effective cardiovascular exercise is. The second exercise component would be your strengthening and stretching. So this is where you would hit the gym area and hit some of the machines. To give you some examples of what you might do is, if your hamstrings are tight because maybe you sit at a desk or maybe you drive a vehicle and your hamstrings are consistently in that shortened position, we would do a hamstring stretch. We would also do strengthening because you have to balance the muscle out. So some parts of the muscle groups like your hamstrings will be tight, whereas the opposite muscle group, your quadricep, might be weak. So we would want to do some leg extensions to help strengthen that area out. Your exercise routine will also involve manual therapy. Manual therapy is something that sets physical therapists apart from other fields because this is a special skill set that we possess and we can use to help you. So we will be doing some massage work or moving the joint to help mobilize the joint in order to reduce pain, improve your range of motion, reduce swelling, or even facilitate muscle control. So this is a very important part of therapy that we can provide for you. I know that was a lot of information to take in as far as what your treatment plan will entail, but I wanted to give you some basic guidelines to let you know that we are taking your entire body into consideration and trying to develop a plan specific for you to optimize your daily performance of your functional activities. Thank you for joining us today to watch our video on what to expect during a physical therapy visit. You can find our first video on why go to physical therapy on our website, on YouTube, or on Facebook. And join us for our third video on how long it takes to recover.